Hi there. You're doing great.
Thank you. I hope you have enjoyed everything you've been able to see thus far.
Yeah, very interesting. Great job.
Thank you. Well, to everyone that is here, I'm very excited to introduce you to Mercedes and Daniela Kerr. It's actually pretty crazy, but we grew up down the street from one another. We're on the same little neighborhood swim team for a while, and have been family friends for a long time. And I am so happy that we reconnected, but it is unfortunate for the reason that we have reconnected, but so so wonderful to, be surrounded by you guys again. And I so appreciate all of the investment that you have in the Dysunderstood community. But I would love for you to just briefly introduce yourselves and kind of share what brought you to the Dysunderstood community in the first place.
Yeah, I'll go first. So my name is Daniela. I'm 20 years old. I live in Southern California, and I have been diagnosed with POTS, centrally mediated neuropathic pain, and PTSD since the age of 17 in the year 2020. And that was after a 3-year long medical hunt. So like Ella said, I've known Ella for my whole life almost. And our moms actually are the ones who reached out to each other and connected us. And I went to Dysunderstood, really excited to be able to share my story and connect with others who have shared their stories. And I think it's just a beautiful thing. And I'm really grateful to be here.
And I am Daniela's mom, Mercedes, and very grateful for the community that Ella has been building at Dysunderstood. She invited Daniela to be one of the very early sort of people were sharing their stories, and Daniela was one of the first to go. And whether it was coincidence or maybe just the start of something different, I think it really does coincide with the time that Daniela started to rebuild a lot of her network and started speaking out about what she was going through. So it was a great beginning to, I think, what has now taken a life of its own for Daniela.
Yeah. Well, thank you guys. I think that it would be helpful for our audience to know a little bit about the process to diagnosis. Daniela, you mentioned what you have been diagnosed with and what you are currently managing. But if you could just, it's not a brief story, and everyone can actually go listen or read Daniela's story on the blog. But kind of walk through the initial steps to diagnosis that you guys had to take back many years ago.
Yeah, so I actually, all my chronic illnesses were triggered by a traumatic event less than a viral illness. And so after that traumatic event, it was even more of a reason for medical professionals that I went to assume that it was just anxiety or depression that I was experiencing, and with all my symptoms and everything. And we ended up going a lot in the mental health field first, seeing lots of different therapists and psychologists, psychiatrists. And eventually, when the physical symptoms manifested even further, my parents and I started looking towards the medical field and the physical medical field, I should say. And we met with countless doctors, countless doctors. And it wasn't until we went to Mexico, we went to Texas twice, we went to Mexico, where we met a rheumatologist who said I might have dysautonomia. And so we went back home, we started looking further into that. And that's when we eventually were able to find some more answers. We did a tilt table test, but it wasn't quite enough. I had some other things going on, like my chronic pain. And so we eventually found our medical team that has been working with us ever since in 2020.
It was really interesting. It was actually frustrating. We had all of our attention, all of our intention, and all of the resources that you could hope for in terms of searching for answers. And there was a whole constellation of symptoms that was very confounding. And we were going to a lot of different doctors, probably none of them speaking to one another, something that we've heard already talked about today. And so that individually, I think each one of those practitioners, I mean, frankly, probably with good intentions, but nevertheless, sending us down the wrong path, particularly in the mental health field. I think that the knee-jerk reaction by a lot of these professionals was, put her back in the lane, get her back in the lane. She has to get back into school. She has to do the things that are common for a 15, 16-year-old to be doing. And so there was a lot of pressure. And I think in hindsight, that is probably one of the things that I regret the most, is this idea of really being influenced by what people that I thought were very, very well informed, people who I felt were probably trying to do the right thing. And, us going down wrong paths or wasting time, such precious time, some of which may have even really, it only resulted in Daniela's symptoms becoming more and more severe because we were going at it in the wrong way. And so, Daniela will probably want to add something to this, but I think one of the most important lessons learned about the whole journey of diagnosis that I could share here is how important it is to listen, really, really listen to the patient. Because again, despite all of the best intentions, we wasted a lot of time, to be honest with you, regrettably, doing different things that were just not going to result in any improvement.
Yeah, Daniela, do you want to add to that at all?
Yeah, I mean, what she said about listening to the patient, sometimes, the doctor may know better, but most of the time the patient knows best. It is happening in their body. They know what they're feeling. Especially it's harder when you're a female. It's harder when you're a young teenager. I was 14 when all this started. So it's harder for those in minorities. Everybody, like anybody who wants to be singled out will get singled out. And it makes it really difficult for us to be listened to. And that's definitely one of the biggest takeaways.
Yeah. How do you feel that you were able to kind of begin rebuilding trust and communication between you and the rest of your family members?
Yeah, so it was very tumultuous for a long time. I felt like in the years that we were trying to figure out what was going on, obviously they didn't know what was going on. I knew what wasn't going on, but I didn't really know I didn't have the language to describe what was happening to me. And so I felt like every conversation was an argument for a really long time because it was just such a confusing time. And eventually when we did start finding answers and we met our team, and they started working with my parents and me, because when you're in a family unit, when you're living in the same house, it can't just be, we're working on the patient. You will have to work with the rest of the family as well. And I started seeing immediate changes with how we communicated and how we related to each other. And it was like the biggest gift, because at least the space that I was in was safe again, like we could relate. And it was just, that's kind of been what it was like, I think.
Yeah, I read, I think, in one of the comments in the chat, which is interesting because it's something that a term that we have used. I don't know if it's a term that people commonly use, but this whole medical gaslighting concept. Again, just getting to a group of people who really understood what was going on or could at least guide us. There was a lot still to uncover about Daniela's particular condition. But, even at the beginning, just having people talking to us and using language where you could say, okay, I'm trying to make sense of this. Even like the sessions that you've hosted today, Ella, people talking about things where you're like, yes, exactly. It's very validating. It's it helps to provide language. And like Daniela was saying, how do I articulate this, even to friends, and who are wondering what's going on. But for Daniela and for us, it was it was a godsend when we finally figured out, okay, now we're heading in the right path. We are able to communicate with Daniela differently. We understand a lot more about what she was trying to describe then and are now able to help her probably much more effectively than before. But we had to learn that together.
Yeah. And you, Daniela, have a sister, and the family unit, as you've mentioned, was very affected by this situation, and balancing the needs of each individual within a family that is affected by chronic illness is incredibly challenging. As you and my mom have spoken about, when I was really at the worst of my illness, it was like everything, all the energy was put into me, and my sister was on the other side of the country, and my mom was taking care of me full time during the pandemic. So can you share some strategies or practices that have been helpful, and what you've adopted to ensure that each family member kind of gets the necessary time and space to address their unique challenges and emotions when you guys have been navigating this?
Yeah, I'll go first on this one, I guess. I can tell you that there was a period of time where we were absolutely in crisis mode. There's no other way to describe it. And frankly, some of the most delicate periods there, some of the hardest times coincided with the pandemic, so that there was also that isolation to add on top of that. On the one hand, I suppose you could say that the silver lining was that we could access some of the providers remotely, which would have been very difficult to do before. In fact, a lot of the time at the beginning of the diagnosis, by the way, was spent just waiting 2 weeks for that appointment, or 3 weeks out until you could, and every single appointment was like, maybe they're going to have an answer. And we were waiting, with bated breath. And during that time, for Samantha, who's Daniela's sister, she was going to college, she was starting college. It was during her last years of high school and then college. And there is no doubt in my mind that there were times where Samantha was sort of just bumping around on her own because all of the attention was on this crisis, that we were experiencing at home. She's been, a terrific family member and a very supportive sister. And we had to take turns. So Bentley and I, for example, my husband is Bentley, and by the way, for anybody who's paying attention, I'm Mercedes, and so we're both cars. Anyway. It was a lot about taking turns and because we were caregivers, particularly in isolation. And it was giving each other some room, some space, whether it was for work or for travel or for something fun. It's not ideal in the sense that we weren't always getting to do the fun things together, he and I, but then we could take turns. For example, Samantha was a cheerleader at USC when she was going to college. And so going to her games and being there for her as well. But this is something that we've all had to work on together as a family too. And I feel we're in a such much better place today. But it required a lot of, I think, dedication on the part of all the family. And then also, like I said, taking turns and making sure that we gave each other space to do what we really wanted to do that day or something else that was a priority. Daniela, I don't know if you would add anything else to that.
Yeah, I mean, my position in this is smaller since I couldn't do as much while I was sick, but something that I've done in situations, for example, like having a conversation with a parent that's getting intense, or one of us is becoming emotionally charged. Either one of us can say that like the conversation's not being productive and they can leave, or I can leave, or just like making sure we're taking care of ourselves so that my parents can take care of me, and prioritizing me always because I'm ill, but also prioritizing themselves when it comes down to it, because an empty vessel can't serve, and that's exactly what would need to happen.
Yeah.
And managing each other's expectations, Ella, I think that is, whether it's Daniela who's not feeling well, I have to get on a phone call or Zoom or whatever for work and saying, you know what, I will see you at 11. And or with Samantha, we're going to be together at this game, or Bentley going fishing or whatever. Just managing each other's expectations and working as a team, I think, has been a really very helpful part of this.
Yeah. And in my conversations with Daniela, she's been now able to, like, she now has the language and is able to articulate kind of how also this experience has brought her so much more wisdom in navigating, family and also personal relationships. And, how was it when you were having to kind of communicate with people outside of the family? Obviously, all of you were very intimately, thrown into this experience. But it also requires explanation to people outside of your 4-person family unit. So can you talk about how you managed that?
Yeah, so when I became sick, I became very isolated. Like my mom said, it was during the height of COVID, and I was trying to update my friends who still kept in touch with me, and I would like post things on a private story on Instagram, sharing like what was going on, but then that would change the next week and I'd get a new diagnosis, and things were just so like not secure in what I was telling them. So I stopped and I realized, okay, I don't owe anybody an answer. First of all, you don't owe anybody an answer. When you're chronically ill, you can decide who you want to share with and what amount of information you want to share. And then when I finally knew I was with the right people and finding the right diagnoses, I was able to come back to my friends and start rebuilding my social network, as my mom shared, and with my family as well, extended family, and everybody just like working together and trying to understand each other. So yeah.
And you also, you will find friends who are also very well-meaning and with good intentions, but there were a lot of just own up to it, Mercedes. Daniela has anxiety, kind of feedback from friends. And I've never been, embarrassed, ashamed, or anything else, about what we've been going through. I mean, it's something that's just happening. So I have no problem sharing our experience. I love doing that here today, but at the same time, it's interesting because it almost opens the door for everybody to have their feedback, to give you their ideas of what they think is going on. I want to say that today, as compared to say 3 years ago, not only because we know a lot more in our family, but I think that there's also just a better awareness. Things like Dysunderstood, Daniela's blog. Daniela started a beautiful blog. She started finding others who also were talking about these kind of conditions. I feel like there's more information out there, so that when I'm trying to tell somebody, there's this thing called dysautonomia, I don't get blank stares or people saying, oh my gosh, you have now fished to the bottom of the barrel to find the weirdest condition you could think of. I think that it's a little bit more, there's more awareness, and so it makes the conversation easier with friends who are interested and want to know more.
Yeah.
Oh, and something I would add too is that, like, from my blog and podcast and from Dysunderstood and another nonprofit I work with sometimes called CHIP, for creative healing for youth in pain, I've made friends with people who have chronic illnesses. And that has been such a special thing that I didn't think I was missing out on until I realized that I was, when I made those friends. And that's so special, because nobody understands a chronically ill person better than a chronically ill person.
Yeah, it's so true, unfortunately. And speaking on this idea of like having connection, a support system, a community, how did you guys manage to build a sense of community, even with people that maybe didn't totally understand, but wanted to be there to support you? Were you willing to take the support? I know sometimes it's, people want to help, but you don't know how they can help you. And it's often a challenge to accept help. But do you mind talking about, how you were able to at least build a sense of community and support?
Yes. So it started off, I think, when we met our medical team. And I was in such a state of like dysfunction at that time. I had gone through that medical gaslighting for years and was bedridden, and I was even vocally screaming like constantly because of the neurological condition I have. So when I met our medical team, there was somebody in our team who had just had to kind of get in there with me and build that trust again. And from there, I was able to start accepting a therapist into my life. And then from there, I was able to start reaching out to friends and maybe hanging out with old friends and setting up appointments that I knew I would limit to an hour, because that's all I had the strength for that day. And then, like I said, making friends with chronic illnesses through multiple platforms and getting to know those people and really making bonds with those people. And like was touched on in a previous session, having online resources and just even having groups. I'm in a spirituality group and I've met friends through there, and I'm just like slowly adding things in. I'm reaching out to my family members. who don't live so near me. And it's just been a gift to have life again and to have those people in my life again.
And for us, I mean, you were mentioning that your mom put us together, and I don't know, I don't remember exactly how we had heard about each other. Somehow we had learned a little bit of what was going on with you, Ella. Your mom had heard a little bit of what had happened to Daniela, and so she reached out and she said, "Can we compare notes?" And there is a tremendous amount of validation in that. There's you know, particularly when you feel like you're dealing with something that is not very well understood, it's disunderstood. And just, you know, if recognizing that, hang on a minute, there are others out there. Hearing some of the stories today, for example, okay, people are making do, they're having children, my gosh, you know, they're having careers, or even they're struggling on some days but have other successful days. So you start trying to learn from those experiences, and I think that that's been really validating, but also very, it just gives you an idea of, wait a minute, there are different ways we can navigate this. And so all of those examples, I think, have been very helpful to us.
Yeah. Well, it's challenging, like you said, to know that, you know, some days are good and some days are not as good, and you keep pushing forward. But as you're very familiar with, Daniela, too, healing follows a very nonlinear path. And, you know, once you started to find answers, it, you know, provided you the space to have a little bit of hope and to feel a little bit more understood, and maybe to open up again to other medical professionals. But could you share some important lessons that you've learned to continue to stay motivated and helpful throughout this unpredictable journey?
Absolutely. So something that I've learned is that it is actually impossible for healing to be linear. Like, and by that, I mean, the struggles and the dips and the process is that's what builds that strength. That's what creates that learning experience and actually starts that healing process, because that's the whole point, right? And one of the big things that keeps me motivated is my goals and the things I want to do in life, because like the majority of these kinds of patients, we want to do things. I want to heal others. I want to travel the world. And I just want to enjoy life in a way that I haven't been able to since I became sick. And I know I need to further heal. And by doing that, I know that I can help others. And that's another thing that keeps me motivated, and my own growth and my own expansion. And by that, I mean, knowing that every challenge and obstacle is growing me into a better and stronger person who can take what I've learned to help others. So that's really important. And I do that through places like Dysunderstood. I do that through my blog, my podcast, and these outlets bring me a lot of purpose and a lot of joy. And I would say the last thing to answer this question is something I find surprisingly motivating, is knowing that every moment and every feeling is temporary. Just knowing that you don't have to push past every bad feeling, because it will pass itself, and you don't have to have that pressure on yourself to push it away and to make it better every second. I think that's something really important and something that's a big relief for me.
Yeah, I mean, for Belly and I are both fixers. We want to fix everything. You know, we get things done, but it's kind of not very different from this idea that I was mentioning before about trying to get back in the lane, you know, pushing somebody back into the lane forcefully, and it just doesn't work. And it's counterproductive, even, I would go as far as to say. But, you know, with respect to one thing that it has taken us a very long time to learn, and we probably relearn it all the time because we have to remind ourselves of it, is this idea of just being patient and being kind. And so if you are having a bad moment, if Daniela is, for example, really struggling that day, or even any one of us, because sometimes we might also have reached a level of fatigue, you know, Bentley, myself, or Samantha, you kind of working through it and being in it and sort of being patient and kind, and, you know, just because it will probably resolve itself. Maybe we'll get some better sleep tonight, and tomorrow will be another day. That kind of acceptance, if you will, and I think Daniela has written poems about this that are very powerful. that sort of acceptance is very hard to get to. It's something, like I said, we probably have to relearn and remind yourself of all the time, but it is very, very, at the end of the day, it actually does work, because sometimes going against the grain and trying to say, no, 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 it's okay, it doesn't necessarily get you to okay.
And something about that acceptance is that when you're not ready to be in a state of acceptance, you can't force it. I know people will try to tell me about acceptance, and I didn't understand it. It didn't make sense. It felt like, how could I accept something that feels so wrong and so negative in my life? But it's not about being okay with things the way they are. And it's more about knowing that this is where you are and acknowledging that this is where you are, and then moving on from there. Because something I always talk about is you can't get to point B without knowing point A. And that is something really important about the acceptance piece.
Yeah, and I have to tell you, as Danielle's going through, a lot of healing and a lot of therapy, physical therapy, in all kinds of ways. Sometimes I have to remind myself what life was like 6 months ago, 2 years ago, and some things that we thought were not possible and are possible today. I mean, right now, Daniela and I are not in the same place. We're not in the same home. Daniela and I probably have been attached at the hip for the past 6 years, and right now she's actually spending a little bit of time away from mom and dad up in Los Angeles. I mean, I couldn't have thought of it a few months ago. And so my point is to say that even in those moments where you say today is a bad day, sometimes it helps to remember, what, this is actually progress. So we are doing things, and so it is not linear. Sometimes it's one step forward, one step back. But overall, the trajectory, and because Daniela has been very just consistent and dedicated, and this is also a common theme that I've heard today about the people who have spoken, then also when they were talking about others that they have worked with, there is a lot of grit here with a lot of these, people who are in these conditions and are working through it. And it does make a difference. And it's not linear, but you'll get there.
Yeah. Yeah, Dr. Rowe, who spoke at the very beginning, when he touched on, I've never seen a patient that didn't want to do things. That's one of his favorite things to tell people, especially when they're skeptical at all, or if it's just a teaching point. All of his patients, the minute they have the opportunity to go back to school, to, go back to work, it's something that they no longer take for granted because of that experience. So do you mind talking about, you touched on it a little bit, realizing the progress that you've made and how far you've come from, certain moments that have been incredibly challenging, but what are the things that you guys are able to do now together that is something that you see as special and has now been, a part of your life when it wasn't before?
I mean, something as simple as watching TV together, honestly, to begin with. I couldn't watch TV for a while, it was too overstimulating. And now we can watch a show and have a laugh and have a moment where it's not all about the illness and about the negative parts of our lives. So that's something I really enjoy, and it's an easy thing for me, so I can rest and also enjoy her company. I don't know. What do you think, Mom?
Well, the other day, was it like a week ago or two before you went to Los Angeles, she went to the supermarket with me for the first time in years. Here's the trick though. So I am like delighted. We're going up and down the aisles and I'm asking her, does this sound tasty? You know how whenever you go to the supermarket and you're hungry and so everything looks good. And so we're just going up and down the aisles, and we're about halfway through the supermarket when she looks at me, she says, here's your warning. Like, I'm giving you the 5-minute warning, Mom, because I'm running out of steam. Because otherwise I would have probably spent another 2 hours at the supermarket with her. So there's this, constant having to remind ourselves. And I think, again, I heard it earlier. So it's interesting to hear these recurring themes, knowing kind of what the early warning signs are, what the limits are, making sure that you kind of don't push yourself to the point that you're going to regret it. And then you're not going to want to go to the supermarket again because that last time you went was just so hard. And so it's a lot of just being in tune with each other. We don't do it perfectly all the time. I wish I could tell you we do, but we try, and we're always listening for those, just so that we can make these new experiences enduring ones that we can always come back to and find some joy in.
And let me bring up that in that supermarket experience, it was my med time and we were in the middle of the supermarket. So we had a tag team and we called my dad. Also, I was in a wheelchair, so we couldn't hold all the food on my lap anymore. So we called my dad, he grabs my meds, he meets us at the supermarket. She takes me home, he pays, and everything worked out. But that's another example of like that, taking turns and just like working together and being open to helping each other out.
Yeah. Well, it sounds like a beautiful picture of you guys working as a team. And I know it has not been easy, and it's been a learning experience, but is like such a great example of how, you know, working together and relying on each other and having people to rely on can allow you, Daniela, also to have, you know, an enriched experience and know your limitations, but also be able to sometimes challenge yourself and feel like you're in a space where you're allowed to express how you're feeling, and make sure that, you know, you're able to set your boundaries without feeling judgment. So I truly appreciate that.
Yeah, something that's really important, and it was mentioned earlier, but knowing when to push and when to not push. I think that's a very important topic. And my parents helped me with that too. But for a long time growing up, I think I had to stop listening to my body and trusting what my body was telling me. And so now that I'm relearning so many things and working with this team, I've been really trying to listen to my body. And that's something so important. And to speak up when my body is telling me to take a break, or when it's telling me to maybe push this time. And my parents can help me with that too. Yeah.
So you guys are functioning as a really effective unit, it sounds like, and you've spoken about your current provider group, and your positive experience with them is, you know, seems remarkable, and I'm so glad that you've been able to find a team that you feel like listens to you and can give you, you know, positive direction to work towards. Can you elaborate on the factors that you think contribute to this strong working relationship, both among your providers and then also between them and your family?
Yeah, I guess I'll start by telling you first that because we were so entirely confused and we knew that Daniela was experienced physical symptoms because her heart rate would just go, you know, through the roof and then come back down to almost nothing. I mean, they were just weird. I mean, we were looking at each other, you know, regularly, like, do we call 911? I mean, it was really just, we did not know what was happening. So I'll start by telling you that this is now the extreme of all of parents trying to figure out things. We actually hired one of those doctor groups that tries to figure out difficult conditions, and they didn't work. They took us to every single specialty you can think of, and they created a binder of information, but each doctor was kind of, you know, seeing Daniela individually, and they were not really connecting dots together. And so that didn't work, even as extreme as it might sound. And on a particularly random Sunday, Bentley and I were sitting, you know, in the living room. He's looking through. We're trying to find answers. He found this website, and they said something about working with children, and something about whatever was on the website resonated. And he placed a phone call, thinking he would just leave a voicemail for them to get back to us during the week. And somebody answered. And this was the husband, who's also a physician in his own right, of the doctor, the lead doctor in Daniela's team, Dr. Seltzer. And Dr. Seltzer had been the lead of the pain clinic, the pediatric pain clinic at UCLA for about 30 years, and was now doing this in her retirement project, if you will. And the very big difference in what Dr. Seltzer did for us, as compared to anything else that we had done before, all of the extremes that we had, you know, gone through, is that she was able to just be, maybe because of her, well, certainly because of her knowledge, but also because of, you know, she was well recognized and respected. She was able to actually assemble a group of doctors that could be in the same Zoom or on the same phone call at the same time, comparing notes with each other. Gastro, neuro, cardiologist. I mean, every specialty you can think of. And then she also had a very special group of therapists that I'll let Daniela talk about. But just this communication among themselves, real time, comparing notes. She was, you know, sort of one of those crowdsourcing, on public international physician websites, here are all of the symptoms, and her ability to gather all of these different points of view together, I think made all the difference. But I'll let Daniela talk about what she experiences there.
Yeah, so the first time I met this doctor, Dr. Zeltzer, and I was screaming and I was out of control, so it appeared, she told me, you're not crazy. What you're experiencing is real. That's like one of the first things she told me, unlike anybody else I had ever met who blamed it on myself and my desire to get better. But she immediately made me know that I was in the right place with the right people. I had an instinct that it was immediate, that, yeah. And like my mom was sharing, there's a team of therapists, behaviorists that she works with that really do know these types of illnesses and really do know how to heal these types of illnesses. And I think I might have mentioned, I can't remember, that the one who built that trust with me is chronically ill with many of the same illnesses that we've been discussing today. And she has been a crucial cog in the well-oiled machine that is my team. And they communicate with each other, like my mom was saying, and with my parents, but most importantly, in my opinion, they are open to my input and they listen to me fully. And that is something I am just so grateful for. And that's what every person with these types of illnesses deserve.
Yeah. Yeah, it's interesting because, a lot of patients that develop these illnesses are under the age of 18. And I think balancing, the communication between everyone in the room and every party that's involved is important. But like you said, it's like, let's hear from the source. And I am so glad that, you found out the provider that is guiding the care to make sure that they're listening. And I think that, there are so many physicians that have the right intentions. And that's something that even the providers that are in this space will say, and there's so many systemic problems that we have to work out in healthcare to make sure that we're better suited to manage patients with chronic illness, especially those that are poorly understood. But how do you think that your team and your provider, validating your experience helped you in your healing?
Yeah, so like I said, I worked with this one behaviorist in the very beginning. That's pretty much the only person I worked with, other than little sessions here and there with Dr. Zeltzer. And sometimes she understood what I was going to say even before I said it, because she knows these things. She experiences these things. And it finally made me stop that desire to be understood by everyone I meet, because it was such a desperate need that I felt. And finally I had someone, I was like, oh my gosh, this is right. I'm not gonna suffer and get worse for the rest of my life. I can find treatment now. I can have an opportunity to live the life maybe that I thought maybe I wouldn't be able to live anymore. And that validation really showed me that.
Yeah, and I think that, for Daniela, the fact that this was so well-rounded, we had, because there were these issues happening with her heart. There were all these very serious physical manifestations. And one of the things, and I'm not sure how common this may be or not, but Daniela is highly sensitive to medication changes. And we have to when we go through when we're testing and trying different things, it could have very severe consequences if it wasn't managed adequately. And so getting the right sort of combination of medications for her was elusive for years, and finally at a place where we could really start seeing the benefits of it. And so that again was part of the whole everybody talking to one another at the same time. But then helping all of us understand what we were navigating and what was going on. I think at least for Bentley and for me, it took us out of that sort of my hair is on fire crisis mode, where we were constantly pushing what else, what more, we need answers. and actually just let us kind of put ourselves in the hands of a team, and be confident that we were being guided in the right direction, because we knew we had been guided in the wrong direction multiple times before. So all of that, I think, was incredibly powerful. By the way, I want to make sure that we're clear that Daniela is in the thick of it. I mean, she works every day very hard. She's not out of the, the most difficult periods yet, because it's still, but the progress that we have, seen and what she is doing today compared, like I said before, to 3 months ago, is astounding. But it finally put us in a position where we could really work kind of more productively, I would say, because the effort was always there by Daniela and by everybody else. It just wasn't getting us very far.
Yeah. Yeah. Do you mind speaking, Mercedes, about the healing process from your perspective, and as a caregiver, and you're continuing to be a caregiver, but what did the beginning the healing process look like for you? Because it's obviously been challenging for you in your own right, separate from, Daniela's individual experience.
Mm-hmm. Mm-hmm. So I think at this point, all of us in my family have had some kind of therapy at some point or another. Mostly as I just trying to find some resources so that we could, get support ourselves. And one of the recurring themes has always been, prioritize something that is whatever it is that you like to do. Like I said before, in the case of Bentley, he loves to go out fishing or diving or whatever. For me, it's spending time with my family who's all over the world. And so maybe going on a trip to visit. But, making space for that, I think, was part of it. And it's kind of almost impossible. You want to be there and be protective of your child. You want to be there for every minute of it. But, sort of being talked into this idea, you've got to make space for yourself. And I think was maybe step one. Today, I think, as sort of the healing continues, and I get tremendous enjoyment out of, for example, all of the things that Daniela writes, and all of the things that her blog, and I mean her poetry, and so all of that is putting into words, I think, a lot of what maybe some of us have felt at some point or another in the family. So that's part of our healing process too. Tremendous finding joy in things, like I said, Samantha's participation in school, and her graduation and all of that. So allowing ourselves that space and that room to, because there were moments, I'm not going to lie, there were moments where when things are so dire, you almost feel like it's unfair and it's inappropriate for me to enjoy anything, because I have my daughter back at home really suffering right now. And so getting out of that and sort of moving forward and saying, hey, it's okay to sort of feed yourself those doses of joy. And I think it was part of the healing process for me. And we're a very tight-knit family, maybe you can tell. And we do support each other a lot, but we even get sometimes good feedback from Daniela's behaviorist, who is very, very much in tune with what's going on in this household. So she sometimes actually might be the one to sort of guide us a little bit and give us a little nudge, and so I think we've all benefited from that, from the therapy, to be honest with you.
Yeah, and to add on to you guys doing fun things, that's been a very recent part of my healing journey, trying to incorporate positivity and fun things into my life again, because again, it also felt inappropriate for me to enjoy myself, because I felt like, oh no, everyone around me will think I'm okay, and then they won't understand when I'm struggling again. And it was a very complex situation. And so I'm in LA, like my mom said, I'm away from home right now, and I'm doing things that make me happy and doing things that bring me joy. And it's as simple as that. And that's healing, and that's important.
I'm so happy to see you, out of this like routine, I guess, that you had to, set for yourself. And the very cool thing is that, you talk about acceptance, meaning not necessarily not loving the situation. You don't have to love it, but just understanding that where you're at, and these setbacks, as we've talked about before, become, less and less, because you learn how to how to manage and how to prepare yourself and prevent, worse flare-ups. So it's all, it's an experiment for sure. But there was a question in the chat, and your sister, who is on with us also, shared your blog. It's called For the Healing Soul, and I also highly recommend it. And Daniela also has the podcast, and it's linked in the Q&A for everyone here to view, and I'll also send it in the follow-up to everyone that attended the conference. But we've talked about so much today, but I kind of want to leave with an open-ended question. If there's anything else that maybe has come to mind or advice that you would give to patients, whether they're just starting this journey, just received a diagnosis, maybe Mercedes, any advice that you have for caregivers? I want to leave this last couple of minutes open for you guys to impart any more wisdom that you want to share.
I'll give Daniela the last word, so I'll go first so that she can be last. But what I would say for caregivers, there are actually resources for us as well. This idea of you can't, what was it that you said, Daniela? You can't pour anything out of an empty vessel. The whole adage, the old adage from you put your air mask on first before you can help somebody else. It is important to take time and care for yourself, because I think that brings a lot more energy to whatever you're trying to do to help your loved ones. So that would be my recommendation. And Daniela? Yeah,
so what always comes to mind, if I could give any message, is do things in your own pace at your own time, in your own whatever. I switch that, reverse it. And that's so important, because a lot of my healing journey was about forcing me, like my mom was saying, back onto that path, back into that lane. And that wasn't the right way to go, especially because I was saying that wasn't the right way to go. And listening to the patient, but listening to when the patient says no, especially. And not forcing yourself. I have high expectations for myself. And so I don't even need to be pushed by other people sometimes to feel that urge to do something more, to do something better. And sometimes I just have to say, not today, not right now. I can't force this, because when you force something, it's not going to work in your best and highest good. It's just gonna fumble somehow, or it's not going to help you heal in the right way. So just take your time and listen to your body and listen to yourself.
Well, thank you both so much for spending part of your weekend with us. I'm so grateful for the time and the emotional energy that you've spent to be here. And I know that so many people will benefit from hearing your story and also resonate with a lot of it too. And thank you for also being such a great example of openness, vulnerability, and I am sure that so many people are celebrating the progress that you've made and are grateful for your contributions to this community. So
Thank you.
Thank you so much.
Thank you.
Of course. We'll have a great rest of the weekend. And I will be in touch with you guys soon.